and welcome to the TAS Health and Wellness Show. So today we are at Aster Royal Hospital where we shall be chatting with Dr. Nikhil Jain, who is a general surgeon and with specialization in laparoscopy surgery. I'm guessing you're wondering what laparoscopy is. So let's find out with the doctor itself. Hello doctor, welcome to the show.
Thank you.
So we all want to know what exactly laparoscopy is.
Yeah, laparoscopic surgery is actually a minimal invasive surgery, wherein we do the operation through a minimal invasive method.
Right.
Herein we use various types of instruments and camera and screen to do the operation. We make keyholes basically to enter the abdomen and insufflate gas, and we do the operation.
Okay.
I could just show you how we do it.
Sure.
These are our instrument panel.
Yeah.
We have the screen, we have the camera unit, this is a camera, and we have the insufflator from which we insufflate gas inside the abdomen.
Correct.
Okay.
Correct.
Here is our instrument tray. These are the various instruments that we use to do the operation.
Right.
Okay. And the good thing is that it's a minimal invasive method.
Right.
Very, very small skin incisions are there,
Right.
and which is also cosmetically very good for the patients, and they are very satisfied with the outcome, clinically and cosmesis also.
Lovely, that's nice. Didn't know something like this existed. I'm glad we got some information about it.
Thank you.
So doctor, as a specialist at Aster Royal Hospital, can you please tell us more about the Aster Royal Daycare Center for minimal access surgeries, particularly the laser hemorrhoids and fistula treatments? Also, how does the center provide efficient care for the patients who have the procedures done in a single day?
See, daycare surgery is basically when the operations are done and the patients are admitted on the same day and discharged on the same day.
Right.
At Aster Royal, we have a dedicated daycare surgery center wherein the patients are preoperatively worked up, they're admitted in the morning, their procedures are done, and they're discharged the same day. Especially procedures like laser hemorrhoidopexy, laser fistula treatment, the patients are treated in such a manner because there is no skin incision.
All right.
The post-operatively there is very much less pain for the patients.
Okay.
They require a short time of observation,
Right.
and therefore they can go home on the same day.
Interesting.
Our daycare surgery center has a dedicated staff
Right.
with all the equipments available.
Right.
And the good thing is that our center is at the same level as the operation theatre. So there is a seamless flow of patients, and we maintain the standard of surgery because we do it in the same operation theatre like any regular patient.
So doctor, in your experience of working at Aster Royal Hospital, how has laparoscopic surgery been better than the traditional surgeries? And what benefit does this minimal invasive technique offer?
It's been almost more than 40 years since the first laparoscopic appendicectomy was done.
Okay.
Since then, the world over, numerous evidence has suggested and
Right.
proved
Right.
that minimal invasive surgery, that is laparoscopic surgery,
Right.
causes less pain to the patient. There's less chances of wound infection. The patient returns to work quickly. Surgeries like hernia procedures, gallbladder surgeries, uncomplicated appendicitis, they can in fact be done now as a daycare procedures, utilizing this laparoscopic approach.
Right.
So the patient is actually doing the operation and returning to work very quickly with minimal pain and minimal comorbidities. So that's the advantage of laparoscopic surgery.
That's good. That's good. I'm sure then in that case a person can go back to work as comfortably as he was
comfortably
before.
and as soon as possible.
That's nice. So doctor, let's talk about lift procedures. The lift procedures for complex anal fistulas sounds intriguing. So could you please tell our viewers that how this procedure is performed and how it has affected positively on the patient's lives? Also, could you please share some success stories to our patients so that they feel positive about it?
Sure. You see, lift procedure or the ligation of the intersphincteric fistula tract is used for complex anal fistulas. To understand, our rectum is surrounded by two sphincters, the internal and external sphincters. These complex fistulas actually traverse both the sphincters and connect the rectum to the outside skin. Treating them conventionally was a big challenge. The patient had to come again and again for multiple settings. A thread was inserted called a ceton, and it had to be tightened regularly.
Right.
It was very comorbid for the patient.
Right.
Now with the development of this technique, wherein we go between the muscles and we disconnect the fistula And here at Aster Royal, we are using it along with the laser ablation. The remaining tract we ablate with laser, and the fistula is treated in a single sitting. The patient is discharged the next day,
Right.
and he is able to return to his work again because it is very less painful. And that's the advantage of it. Single sitting and less painful and good early return to work.
Yeah.
And the numerous patients, they have come here from interior who have had their fistulas operated or had a complex fistula, and after being treated with this technique, they had a very good post-operative recovery, and they had a good quality of life afterwards.
Lovely. Any success story that you have that you could mention?
Yes, there are many patients who had come from Ibra, who had recurrence once or twice, already operated many times, and we did it with this procedure, and they were all happy.
Lovely, lovely. So doctor, now I would like to ask you that with regards to minimal invasive management of hernias, could you please share some cases or examples that demonstrate the effectiveness of these approaches at Aster Royal Hospital, and how have the patients benefited from these techniques?
You see, in the last decade, there has been much advancement in laparoscopic hernia surgeries.
Right.
The laparoscopic approach has actually now become a laparoendoscopic approach, wherein we treat the hernias without entering the abdominal cavity. Okay, and it has so many advantages because we do not enter the abdomen. We put a mesh to treat a hernia that is not in contact with our abdominal organs. And using this technique, we can treat all types of abdominal hernias, whether they are incisional hernias, hernias that occur after a surgery, or whether they are inguinal hernias. The patient, again, because it is a minimal invasive method, the patient can be discharged, in fact, the same day, has minimal pain, and a very early return to work.
Good. Almost all the treatments, a patient can go back to work as soon as possible, which is good for them.
That's the big advantage.
Yes, that's a good benefit.
Yep.
All right, last but not the least, doctor, I would like to ask you that laser techniques like FILAC and WAFT are innovative treatments for anal fistulas and hemorrhoids. So how are these procedures performed, and what advantages do these offer in terms of pain reduction, shorter recovery time, and improved quality of life for patients treated at the Aster Royal Hospital?
Sure. You see, anal fistulas, it's a very debilitating condition for the patient.
Right.
The patient suffers from pain and discharge, which affects his quality of life, and of course, he's not able to work properly. FILAC is the fistula tract laser closure, and WAFT is video-assisted anal fistula treatment. In these techniques, we use a very small camera called a fistuloscope. We go inside the fistula, we identify all the accessory tracts, and we ablate it with a laser. The advantage is we can identify any extra tracts which might actually be missed on a traditional operation, and thus minimizing the chance of recurrence. The other is there is no skin incision again, so less pain, good recovery, the patient can go back the same day, in fact.
Nice, that's good. Thank you for actually briefing us about what exactly FILAC and WAFT is, because trust me, most of our viewers never knew about it. Thank you for that. And thank you so much, doctor, for actually having a chat with us today from your busy schedule. I'm glad to, you were able to give us so much information and our viewers.
Sure.
Thank you so much for your time, doctor.
Thank you very much.
Thank you.
Thank you.
So for more updates like these, please follow the Arabian Stories.